Okay, we are live and welcome to episode 3. This is of Medical Mondays with Dr. Sylvia Hollowell. This show is brought to you by the 7 Spheres of Money. Thank you for joining us. And before we start the program, just make sure you like and share this video and subscribe to the 7 Spheres of Money on YouTube. And I will also like to bring your attention to this message before we start as well. Just give me 1 second to share my screen. Okay, so a disclaimer. This show is for general informational purposes only. Dr. Hollowell in practice assumes no liability for any medical outcomes. You should always seek medical attention from your own personal physician for specific medical concerns. So now that we have that out of the way, let's go ahead and get started with the program. So first of all, there she goes. All right. So first of all, I would like to greet the two of you. Well, of course, you know Dr. Hollowell, and Dr. Hollowell will introduce our guests, but I would like to greet the two of you by saying Happy Mental Health Awareness Month to the two of you. So how are you, Dr. Hollowell?
I'm well. So thank you so much for another episode of Medical Mondays. I'm very excited for this show. And the reason being is because as a family doctor, we're somewhat of the first point of care for our patients, right? So people come to see us first before they get into the other areas of specialty care. So over the past 13 months, we've actually seen an increase in the amount of our patients coming in with mental health conditions. And as a matter of fact, nationally, the numbers are such that it's been like 4 times more than what we've seen in the past. So this, this show really has to be addressed. As a family doctor, as you guys already know, because most of you guys have family doctors, I hope. So we are a comprehensive field. So we see all ages from newborn to the elderly. We see all medical conditions from the common cold to cancer. But however, we're like detectives, right? Because not everything is so simple and black and white. So we look at things from a multi-layered approach. So we look at things from both a cultural, a social, a physical, and a psychological perspective, because only then can you treat the total person. If we want to help our patients reach their highest state of health, we really have to look at all factors, because you can't really have great mental health without having great physical health. You can't have great physical health without having mental health. They're linked. So the issue here is that, unfortunately, because we have so many of our patients coming in with such traumatic experiences, and again, stemming primarily from the past 13 months, we definitely have to address something like this. And that's why I'm so excited to bring in our expert, who's an expert therapist. And I'm going to introduce her in just one moment. I also wanted to mention the reasons, in addition to what I just talked about, is if we look at the issue with COVID, right? The whole 13-month worth of craziness in our lives. Clearly, this has been a really torrid experience for most of us. And if you can put up that slide, Nick, I just wanted to show our audience some of these numbers, because interestingly enough, this period has really affected our youth more so than any other. So more so than adults or elderly. So unfortunately, if we look at these numbers, if you look at the slide here, it says the percent struggling with at least one mental health problem. If you look at the age group 18 to 24, 74.9, that's 75% of our young people have dealt with at least one mental health condition. So look at the other stat. between 25 to 44, 51% is still significant. So if we go down in that slide, as we go up in age, the mental health conditions actually decline. It's something that we would intuitively think would be the opposite. We would think the elderly would probably have a hard time adjusting. But part of it is, is with kids, is that they may not have the, the resilience that is built up with going through years of tough times. So, so also too with the youth, they've been struggling through this whole COVID period because part of their development is dependent on social interactions, right? Everything was so different for them. Even dealing with the homeschooling, or the virtual, it's a little different than homeschooling, but kind of like the virtual learning, it's still important for the kids to have some sort of social interactions. Even they have development, and in terms of their esteem, a lot of it is and their personalities are developed based on their interactions with their peers, right? So a lot of them didn't have as many interactions because we were isolated, and so unfortunately they had to sort of resort to developing friendships online, which is definitely not the same. The other issue is missing major milestones in life, with celebration of birthdays and graduations with a whole bunch of people, family members. So there's a lot of other things. And of course, with young people seeing the images of negativity everywhere, media, even going on social media, the screen times have increased. So on average, we're saying that young people, are on social media for an average about 9 hours a day. That's a lot. Adults are about 10 hours. So we know that there's a lot of negative imagery, and there's a lot of issues when people just focus on social media for a majority of the day. It's so important to limit screen time. So there's a lot of reasons, but if we look at this, thank you, Nick, for putting that back up. I still wanted to kind of talk about the youth for a second. So if we look at the stat again, 75% of youth, that's a lot. Even parents. So we did a research study so far, and we were noticing that parents, about half of parents, a little less than a half, have actually sought mental health counseling for their kids during this time, which is interesting because we've never seen that before. In terms of suicide, thoughts, in youth, that increased to up to 25%. We're talking about, suicide thinking of thinking of the method of dying, thinking about dying or ways of dying. Whereas in adults, it increased a bit to 11%. If we talk about African Americans, right? So that number is pretty high for us as well, higher than what we've ever seen before. So in comparison to white counterparts, actually the suicide rates for African Americans have gone up in general. Both children, adolescent, and adults have gone up, whereas the suicide rates in terms of people actually committing suicide has stayed relatively steady in the white community. And there's a lot of reasons for that as well. So of course, when we talk about us as African Americans, there's a whole lot that we generally have to deal with, but during a pandemic, it's double that, right? So, so dealing with the loss of jobs, dealing with financial insecurity, dealing with food insecurities, dealing with the trauma of having imagery of racial issues constantly in your face, living that trauma over and over again, as we've seen this past summer, and beyond, because we're constantly, having to kind of feel that trauma with our people continuously, and that it takes a toll. We tend to be, as African Americans, we tend to be overall, resilient as well, because we've been through a lot, so since 1619. But nevertheless, it really is affecting us. And so that's why it's super important. When we look at, the economic devastation, the old adage, Nick, you might be too young for this, is when white America gets a cold, Black America, gets pneumonia. So we get things 10 times worse, right? So even when we look at small businesses, there's a lot of small businesses who, did relatively well. But when we talk about African-American businesses, they were 41% less likely to get the loans. So you've seen almost half of Black businesses closing down, right? That's a lot of tension because that was a source of income for many people, right? So, so you add that, you add loss of lives, right? Again, in this country, almost 600,000 people have died. If you were African-American, you were 2 times more likely to get COVID, right? And you were 2 times more likely to die from COVID. And there's a lot of health disparities. Unfortunately, even when you get to the hospital, the care is different. It can be if you don't have an advocate. So there's a lot of trauma, and there's a lot of reasons for this these mental health conditions. And when I say that, for the sake of today's show, I'm just going to limit it for the most part to, depression, anxiety, stress disorders, because there's a whole lot of mental health conditions that we can talk about, including post-traumatic stress disorder, which, a lot of people have had. There's been an increase in that as well. So, so there's a lot going on. I mean, a lot of people were pushed, 8 million people were pushed into poverty, this year. If we look at, our colleagues in terms of our healthcare workers, and some of them will hopefully see this show, we have to understand that, we all deal with something called emotional exhaustion and burnout, because we're only human. When you constantly see, loss, and I've lost patients, right? And that's why I'm just devastated. And that's why I wanted to sort of get the word out to people about COVID and about vaccinations and about how we can, help, because I don't want to see another life lost. And so, but all of this is a strain. So we can't underestimate even our healthcare workers who are, also distraught during this time. We can't underestimate the essential workers. And we make up as African Americans, we make up a whole lot of the essential workers. And of course, it's the constant fear of being, especially if you're not vaccinated, the constant fear of being, exposed. Because let me tell you, it's not just death that we're worried about. It's getting COVID and ending up in the ICU and having poor quality of life. And even if you do recover, we have these long hauler, symptoms. And people can get depressed over that. So there's, so this is all layered as well. And then lastly, I just wanted to talk about, why this is important. DJ the Money Coach kind of brought this up on his Friday show in terms of the stigma of, seeking treatment in our communities, because as African Americans, we've always taught to really rely on, religion and rely on our spiritual beliefs. But what we have to understand is it's not mutually exclusive. I'm very spiritual, but it's not to the point where I would say, okay, no, you should seek, help, because this is really something that's very important. But it's, God would not mind if you did seek help, because again, mental health, if you don't have your mental health, it's very destructive for your body, right? People don't realize that it can manifest itself into physical problems, right? Physical chronic problems. So again, depression, anxiety, all the stress, when people come in, they can have physical problems as a manifestation. They can have problems sleeping. They can have problems with just not eating or eating too much. They can have problems with headaches, but also hypertension, increased heart rate, unfortunately, not sleeping. So again, we have to address this. We have to get it at its core, and let's talk about it. Let's be about it. So there should be no hesitation whatsoever. If you need to seek help, let's do it. And so that's why we have a wonderful guest with us who is an expert. I refer my patients to her. She's actually an amazing therapist. Her name is Tammara Kamei, and she has been practicing for upwards of 10 years. And her specialty really, it kind of spans because she sees everyone for the most part, children, adolescents, adults. And she's amazing. When I send my patients to her, they're just like, wow, she's amazing. Even my male patients, are you listening, Nick? Men seek counseling as well, and it's okay. You know what I mean? Especially younger men, it's okay. So they just love you. And also too, she, again, it spans what she does. She clearly, she helps people that have all mental health conditions, including what we're talking about today: anxiety, we're talking about depression, we're talking about, stress disorders. But also too, interestingly enough, she deals with survivors of domestic violence. She also deals with survivors of sexual abuse, as well as sex offenders, which is interesting because she has the mantra that there's, so everyone needs help, right? Because if we're talking about reforming, then it's really, really important to not just say selectively, I'm only going to treat these people and not these people, right? Especially if someone is seeking. So just she has a very non-judgmental approach, very individual approach, and she's very authentic, with her patients. So I'm so happy that she was able to join us today. And also too, I wanted to kind of have her join into this conversation. So Tammara, how you doing today?
I'm doing well. Thank you for such a lovely introduction.
Oh, of course, of course. But I wanted to ask you on this kind of theme of mental health. Are you seeing an increased number of patients who have these mental health conditions in your practice?
Absolutely, absolutely. Especially with the depression and the anxiety. And because it's been shown for so long in the Black community, a lot of people, they're not understanding what they're saying. They can say, oh, I have so much anxiety 10 times and not realizing how that, hey, yes, you're having an anxiety disorder. Hey, you are actually having a depressive episode. So, and it has become very prominent because the outlook, not the outlook, but the outlet that they usually use doesn't work anymore because of all of the changes. So,
Right,
seeing a
right.
very large increase.
Would you say that some people don't even really recognize it at first and you're able to help them through the diagnosis? Or is it just that they know that they have a condition and they're seeking you out for help?
I would say a lot of people don't know that they have a condition. They know they can report the symptoms, just like if I come to you and I can say, oh, I have a fever, I'm coughing, I can't stop coughing, but I'm not realizing that I have the flu. So it's the same, you know. Yeah, so a lot of the therapy is increasing their awareness so that they understand what's going on with them.
So what would you say to people? How would people identify some of the symptoms? And we talked about some of the physical symptoms as well, but what are some of the mental health symptoms that you're seeing of the patients that are coming in? How would people, especially in the audience, how would they recognize whether or not they're having an issue with, with depression or
Well,
anxiety?
well, what I'm seeing is the number one issue or the number one red flag that a lot of people are having is irritability, not being able to have a high tolerance to people. And that goes for anxiety and depression. You know, because when we are in crisis mode, we don't have time to think logically. So if your body is staying in a crisis mode and that anxiety is high, then you're not going to get along with people because you're trying to basically survive. And if the situation or maybe the pandemic, staying inside, the loss of a job, um, maybe arguing with family members because you spent too much time with them and you usually don't spend that much time with them, and so you start realizing barriers in your relationship that you didn't realize was there and you were able to avoid because before the pandemic you can go out. You can go, hey, let me go work overtime. Let me go go to jail, burn off some things. And with those places closing and people getting laid off, now you have
Mhm.
to sit in it and you have to deal with it. So now you isolate in your room, you know, on purpose, with which is in addition to having to isolate because of the pandemic. So if you're sleeping a lot, not getting dressed, not doing hygiene, um, just basically feeling like nothing, not feeling like you worth anything, those are the main red flags to the depression.
Right. So what about kids though? Because kids, it's harder to tell because they won't outright tell you that they feel down or depressed, etc. Are they presenting very similarly to adults?
I'm sorry, you broke up a little bit. Can you say that one more time, please?
Oh, I'm sorry. Yeah. So what about kids? Are they presenting similarly to adults? And also, if you can comment too a little bit on, if there's some substance abuse that may be, involved with this as well. But let's just start with the first one about kids. How do we identify these kind of signs before it's too late, with these kids?
Yes, there. One thing that I like to share with parents is and I share with a lot of the parents that have the kids that have a history of suicidal thought. It's a suicidal checklist. Okay, that isolation is really big with children, and a lot of the times when I'm talking to the kids, the first session, I'm going to talk to the parents because the parents are seeing what's happening with the kids and can report what's happening with the kids, even though the kids can't verbalize how they're feeling. So,
Right.
um, so there's still the same symptoms, still the same sadness. It just maybe manifests in different ways, as into a lot of crying and a
Mm,
lot of being locked in their room. So you have children when they have depression, they don't have a TV in their room, but they're staying in their room the whole day. You
wow.
know,
Wow.
that's a big chunk of depression. What are you doing in the room in the dark and there's no TV? You know, you're not asleep. You
Right,
can't
right.
sleep anymore.
Wow. Are you so that's some of the signs that a parent can tell if they're sort of isolating themselves amongst the isolation that we have during COVID, but if they're even isolating themselves to maybe their rooms and they're just not interacting with the family and as much. Um, so what are some of the ways that we would know if it's getting worse, if those symptoms are just getting worse to the point where we need now to intervene and call you? When yeah, how does that manifest itself? So when would parents
How do
know
you
to
know?
call you, or when would parents call you? When would adults call you, and when would they know to have their kids be seen by you?
Yeah, I think that at that point of what I was already explaining, they should already be calling somebody. Even if it's not me, they should be reaching out for mental health. And and just because you reach out for mental health doesn't mean that you necessarily need medication, because you can be taught the coping skills. But when it becomes worse and the child is actually saying, I hate my life, then they
Mm-hmm.
need to start not just calling me, but possibly calling mobile crisis, because
Right.
that child may be 1 or 2 steps away from wanting to commit the suicide. And you want to stop that in its tracks before it gets to that point. So if a child is moody and seems tearful, some kids cry, some kids don't cry. But as a parent, you should know your child.
Mm-hmm.
Most parents know their child. They know when they're okay
Right.
and they know when something's going on. So
Right.
if
Right.
something is, you can feel, that something is just not right, you're getting the child's giving you attitude for no reason, you know, don't just minimize that as into, oh, they're just being a teenager.
Right.
It,
That's a good point. That's a very good point. because I think sometimes we kind of miss those signs, but we also miss the signs with us as adults as well. I mean, I think that, we, especially as, as I can break down to both Black women and Black men. So Black women tend to always, even if we feel that way, again, it's that resilience, it's that strong, reputation that we have, and that we just keep it moving no matter what burdens are upon us, because we are caretakers. We care for, our kids, or, our parents, our, everyone in our family, our friends. And so it's really, sometimes we just ignore those signs, but it's so important. Black men, in terms of seeking counseling, a lot of times they look at it as a sign of weakness, when really it's not. To me, it's a sign of strength. So,
Absolutely.
yeah. And with that, I would say that, because Nick is an educator, and I don't know. So Nick, would you say that there are, even with your students, I'm not sure what age students you teach, but have you noticed some of the changes over these past, 13 months?
Yes, so I have high school age students. Specifically, I have freshmen and sophomore students, but I also interact with the juniors and seniors as well. So we're talking about teenagers ages 15 to about 18, or 14 to about 18. So yes, I definitely notice big changes in the students' mental health. And as we are aware of many of the obstacles and the traumatic incidents that the students are going through. Some of our students have lost family members during over the past year. Some of our students' families have been hit economically, with the loss of jobs and the closings of business, and it's directly reflected in their behavior in school as well as their academic performance. So we've had students who were, maybe A or B students pre-COVID, and then now they're D or F students.
Wow. But do you have someone also too on staff that could really help along, like a counselor on staff? And
Yes. So we do have social workers, and we also partner with organizations outside of the school to offer social and emotional learning resources. So actually, some of the pictures that you sent me, for the slides,
yeah,
these are some of the practices that we actually incorporate into, or that we offer to the students, such as yoga, such as, manipulative breathing and meditation, things of that nature.
Exactly. So you guys, know how to screen the patients, first of all, students, but first of all, you are pretty keen, it sounds like, on detecting, but, do you formalize it with these screens in the classroom?
Well, that's usually left to the social worker, since they're actually licensed, and they're the professionals. They specialize in doing that. As the teacher, as the instructor, we pretty much look out for the signs, and then we refer those students to those services.
Okay. And so for Tammara, so what's the next step? So when someone contacts you and they go ahead and make an appointment, and let me just ask you this too for the audience. You do telehealth, correct?
Yes, ma'am.
Okay, so, and you do telehealth, across the United States. So we're not just only in Flint, correct? You don't service just the patients in Flint.
Correct.
Oh, okay. Okay, so if that's the case, so it kind of like spans outside. So many people can, seek services from you. So what happens, or what's the next step when they contact you? What is the process which they'll, that they go through?
Well, the process is after they contact me, I set them up with an appointment, make sure whether they're going to pay out of pocket or with their insurance. I work with both.
Okay.
And first session and second session, I do an assessment with them. That's when they're telling me all of what's going on. And as they're telling me what's going on, I'm letting them know, what I'm seeing. And so after they tell me what's going on, give me a little bit about their social history, a little bit about if they have had counseling in the past or had issues with the suicidal thoughts or with depression in the past. They describe to me how intense it was, whether they had to be in a hospital for it or if they were not in a hospital or not. And so after I get that background history, get their family history, even if it's an adult, I want to know, how did you grow up? Because as children, we develop schemas manifest in our adulthood. So one of the schemas that you were just actually talking about of us being a caretaker, a lot of us have that schema of self-sacrificing, take care of everybody else, but then we leave ourselves out. So by the end of the first and second session, I give them their diagnosis if they have a diagnosis. I take the diagnosis very serious because I don't want, a lot of people don't like labels. So if you're going to have a diagnosis, I want to make sure that it is the correct diagnosis. And this is seriously what's going on with you.
I like that.
Yeah. And so I explain what that diagnosis is, what it means, and then I explain what the course of treatment can be. And then we set up in a third session the treatment plan, and we set it up together because I see therapy as into I'm helping you deal with issues that going on with you. But as one of my counselors that work with me say, the client is the expert on themselves. We are not the experts. We are here to be a support system. And that's a reason why we make sure we don't judge. So if somebody I have some people, they may have bipolar disorder. A lot of people are afraid of that diagnosis because it's been shown and spoke about in a negative light. But it's like, hey, it's a mood disorder, It's best treated with medication and counseling. But if you don't want to do the medication, then here are some coping skills that we can use. Because whether you're on the medication or not, you have to have coping skills. Whether you have anxiety, you can get on medication for anxiety, but you still need those coping skills because the medication is not a fix all. So I try to encourage them from the beginning to get on board with working on themselves. So that's the first step. I hope that answers the question.
Yeah, it does. Also too, some cognitive behavioral therapy and other therapies can be just as effective as medications, for some people. So, I don't want people to be afraid of going to counseling because they think automatically, eventually they're going to get on medications. Most of our patients don't want to be on medications. So would you agree with that?
Absolutely. Absolutely. And so that's why it's important. I try to have a lot of bags of tricks, like let's go through the alphabet, trying what works for you.
Absolutely. So, so do you accept all insurances, or do you accept most insurances that people may?
I don't, and it depends. Their insurance depends on the state that the person is in. Okay. So in Michigan, we accept, and it depends on what insurances will allow you to be paneled. Because as in the Black community, what I've noticed, as I've gotten this business going, is that their insurance companies discriminate as well too. So I would be in more insurance. I would accept more insurances, but they won't accept us as providers, so we can't take their insurance. So I take a lot of Medicaid clients from Michigan. I take a lot of Blue Cross, a lot of United, a lot of Optum Health. And when people don't want the label put on them, I encourage the private pay, because with private pay, it's not reported back to the insurances. It cannot stop you from getting any health, any life insurance. So it has benefits. It has a lot of benefits.
Right.
And
Yeah. Well, that's good, because I just wanted to make sure, because access is our, that big term, right? So we want to make sure that everybody, at least has some level of access, because we know that, again, when people lose their jobs, they tend to lose their health insurance. And when they lose their health insurance, they lose, access to any kind of mental health, services. And so, or if we, even here in Michigan, we've, have not really put a lot of emphasis on mental health, even during COVID. I mean, when they developed the task force, they really don't have someone who just deals with mental health during COVID. So, I'm not sure exactly why that is, because it's such an important, topic. So, so that's good to know that you are accessible, which is important. The other part is, I just wanted to ask you, so for example, now that we know how to identify mental health conditions, we know the first step when someone calls and makes an appointment. So after that, though, what are some of the things, and again, you don't necessarily have to, go deep into like some of the things that you would, explain to your patients in terms of treatments. But can you just give us like maybe one or two things that, that you might suggest for your patients, just in terms of conservative treatment? What are some of the things that might be able to help us out here if we're kind of going through some of those things that you mentioned, some of those symptoms?
Absolutely. The first thing I always tell people to do is to put self-care for at least 30 minutes in their schedule every day. Every day. And if you're too busy for yourself, then you shouldn't have time for anybody else. You have to put yourself in your life.
Yes, exactly. So, and then these are kind of some strategies you would use, mindfulness strategies, things like that, stress management, those kinds of things.
Absolutely.
With your patients. Okay.
Absolutely.
And, apart from that, there was a question I'm looking in the chat for you, Tammara. It is, and then I think you answered part of this, but it says, what are some proactive methods we can use today for our children, women, and men? So even the things that outside of your counseling, what are some of the things, that we can also employ for just to be proactive, preventatively?
I think one of the things that I think you probably use a lot, Dr. Hollowell, is making sure you get enough vitamin D.
Mm-hmm.
Because low vitamin D can cause depression.
Yes.
Making sure that we import some type of routine so we have quality of life from what's going on. So find something to make you happy, at least, and find something that your child enjoys and do it with them. At least if you can't spend 30 minutes with your child a day because you might be working, but at least take a time, an hour a week with your child and do some activity with them to get that quality time, so that you keep that bond going. And I say we because, as you know, I have a 1-year-old. So
Yes, absolutely.
I take it very serious with the children, especially.
Absolutely. Our greatest treasures, right? Our greatest treasures.
Yes.
So also too, I just wanted to remind our audience that we will definitely recommend that if you have any questions or concerns, that you can, ask some questions here in the chat, or also too, if you'd like to, oh, this is a good one. Okay. Or if you would like to email the questions, that would be great. I'm so excited. When I see questions, I get so excited. And also too, if you wanted to call in as well, what I see, we're at 39 minutes, but, and we will try to wrap it up shortly, but Nick, what is the phone number if someone would like to call in?
I will actually put the link in the chat.
Okay, great. So we have a good one from Mr. Seven Spheres of Money International. So Tammara, what are some bipolar symptoms?
I think that is a good one. Yes, because in the Black community, every time someone seems to be in emotional distress, it's thrown out that, oh, you're just bipolar. And that's not the case. Let's explain what bipolar is really quick. Bipolar is when somebody struggles between depression and having manic
I think
episodes.
I'm having some audio problems. Are you able to hear Tammara at all?
Yes.
You're able to hear?
Mm-hmm.
Okay. I'm so sorry. I'm having some audio issues. I can't hear anyone. Let me see. I'm going to try to unmute and see. You guys can hear me though, correct?
Yes.
Okay. Just 1 second. I'm so sorry. I'm having some audio problems. I can no longer hear you guys. I don't think Nick, you could still hear me, but can you say something so I could tell if it was fixed?
Sure. Test 1 2 1 2 3.
Okay, it's not. Unfortunately, you guys can hear me, but I can't hear you. And so I was trying to fix my speakers over here. I will try to maybe when Tammara, if you can explain some of the bipolar symptoms, what I'm going to do is I'm just going to sign off and then try to sign back in, if that's okay. Okay. And then.
Okay, so just really quick to explain the bipolar symptoms. Bipolar is depression combined with having manic episodes. So a person that has bipolar can, when they're having a manic episode, that means that you're staying up 3 nights in a row and don't feel the need for sleep. You might feel very motivated to do things that you normally don't feel motivated to do. I always refer to the, you ever seen the movie Limitless, where he takes the pill and then all of a sudden he's doing all of these things and getting all of these tasks accomplished, and by the time he fades off the pill, he wakes up and don't know what happened. So bipolar, you'll know what happened, but you'll have regret. So for instance, not a lot of people, but some people may engage in high-risk sexual activity behaviors, or spending a lot of money in a short amount of time. And then when they come down from having that manic episode, then they're having that regret. Now, you can go from having a manic episode or hypomanic episode, which means it's not as intense as a manic, or then you go to having depression. So depression usually lasts about 2 weeks at a time. In order for to have a diagnosis of depression, it has to last for at least a minimum of 2 weeks. And you're having those depressive symptoms of which what we talked about earlier. So that's what bipolar is. It's going from one extreme to another. But just because you are emotional doesn't mean that you are bipolar. So if you're not staying up for 3 nights in a row and cleaning the house or doing something very intense for about a week and without sleep for 3 days, that's a very big sign of bipolar. And if you're not doing that, then you're not having bipolar. You're not having a bipolar. You don't have bipolar disorder.
Right. And some of those, those symptoms can sort of overlap. So some people actually don't even know, because sometimes if you're feeling very low and depressed, you think automatically that that's depression. Or if you have these very high, highs, you think, oh my goodness, it's anxiety, etc. So that's why, when you see a professional, they'll sort of help you to kind of tease it through, and they're able to identify and diagnose you. So, yeah. So we also have a comment from the Tishtel, and it says, I have a friend who is bipolar and didn't believe bipolar was real. So this is really good information. Yeah, bipolar, unfortunately, is very real, and people, unfortunately, suffer from that, as well as there's a whole host of other, kind of medical conditions, such as schizophrenia and some personality disorders and that kind of thing. It's really real in their lives, because they have to, sort of deal with with those issues. But, those are relatively treatable and controllable conditions. So, and that's why it's so important for people to not to be hesitant to actually seek help, especially from Tammara, because she's very experienced with this. And, I think it's important. Bipolar, tends to run in families. Sometimes we can, the average time that we diagnose is usually like 15, 16 is sometimes when we can start seeing the manifestation of that. But, or sometimes when we misdiagnose it and we say, oh, this is depression, et cetera, when we give medications and people are just not responding to some of those medications, then a lot of times we'll say, well, let's, we'll give you one medicine, then we'll give you another, and then we'll give you another. And it's just not working because the medicines for bipolar is not the same, right? It's different. So that's another, clue as well. And so, but also too, in tandem, with bipolar, it's really important to also seek, counseling. And also too, they tend to respond very well to pharmacologic medications. It's a very serious, condition, but it's definitely treatable. As long as you're compliant with the medications, that kind of thing. So thank you, Tammara. We have 46 minutes. So I just wanted to sort of, kind of go over, unless Tammara, did you have anything else that you wanted to add before I talk about some kind of strategies that you actually talked about? I just wanted to kind of go over some more of them. But did you have anything else to add before I talk about these? And just briefly, because we only have 13 minutes left. So was there anything?
I was just going to agree with you in regards to the bipolar. That is one of the mental health issues, such as schizophrenia, as into where you can go to counseling, but you need your medication because it's a chemical imbalance in the brain. So you need that. You need the medication to go with that. That's something that would be very difficult to do with just counseling.
Yes, absolutely.
And that's okay.
Right. Absolutely. The key is to seek help, definitely to seek help. And there's, there is just, no embarrassment here. This is non-judgmental zone. So it's very important. And no stigma attached. So, exactly right, Tammara. And Nick, I just wanted to show some of maybe if I can go through just a few of the slides, just so that I have patients on my brain because I've been seeing patients all day, but our family, our DJ the Money Coach family can actually see some of these things that might also be helpful. And Tammara actually touched on a lot of these, but I just wanted to show some slides just to kind of add to it a little bit of some helpful strategies. So let's talk about any of them. Again, they're all important. So if we look at, for example, let's look at self-care. And that's the third slide. So this is really important that, again, I just wanted to touch on this just for a second, is that, like I alluded to before, is that a lot of times we really are carrying burdens. A lot of us are carrying burdens, and it's really, we don't really focus inward. We really a lot of us are trying to save the world, and we're trying to do so much, especially as moms, and happy Mother's Day to all those moms out there. But we try to do so much that we really don't concentrate or focus on ourselves. So I would say that, at least maybe 3 days out of the week, take some time for yourself, even if it's a matter of just saying, I'm going to take like 30 minutes to just sit here and just relax, do something that you like to do, whether it's reading, whether it's just, just enjoying TV, or whether it's, it's picking up a new hobby, or if it's, it's just something that you really like. You don't always have to go out and spend money and do all that, but that, Mother's Day is coming up. So if you're listening, men, you can always give your significant other, gift certificate for a massage, for example, or pedicure, manicure. The moms deserve it. So it's really important just to kind of take some time out for yourself and schedule it in. So if we can schedule in meetings for our business, we can certainly schedule some time in for ourselves, and just have a support team where people are sort of helping you. If you're, a new mom and you don't really have a lot of people helping you, just elicit people to just say, okay, I'm just going to take 30 minutes out. Maybe even just for a walk, just to do something, just so that you can really relax. So next slide. So gratitude. So this is interesting. So this is something called gratitude and gratitude journaling. That's like the new thing, right? Is that there's a lot of benefits for doing this. And even if we just, take some time out, I try to, I pray a lot. So I when I'm praying, I usually say about 5 words, of things that I'm grateful for that day. And actually it really does make you feel better when you do that. We know that physiologically it does decrease your stress. And it only because we're not just really focused on ourselves all the time, we're just reminding ourselves that, we're grateful for certain things in life, and not everything is so horrible. If we focus on that, we know that we can, we have some internal benefits. So yeah, physiologically as well, it really benefits you. So the next slide. Okay, so there's some foods to eat. We all know that, and these are some examples of certain foods that help to reduce stress. But I just generally want to say, because generally fruits and vegetables, nuts, beans, and seeds, those are things that I always talk about, to my patients. Those are the food groups that are so healthy. And you know why? Because they're antioxidants, so they're anti-inflammatory. So what happens is when we have, depression, anxiety, that's a state of inflammation, because it can cause inflammation in our body. That's why we have physical manifestations of it. So these are some of the things that you can do to really, to really help, is really just to focus on whole foods, because sugary foods and processed foods really can make your conditions worse. And especially with kids, if they're loading up on sugar and what have you, you have like a crash. And so you feel tired. Feeling tired on top of being tired when you have depression, anxiety, that's not really a great thing. Or feeling too anxious is not a great thing. So these are some of the things, the food groups that are important. The only thing too, I guess the food group that's not on here that I just wanted to stress is that lately we've been talking about the gut, right? The gut as being like the center of, health, and, it's a part of your immune system. And so things like probiotics or even prebiotics become really important for you as well. It helps with stress, believe it or not. So we now are thinking there's a link between, what you put inside your mouth that goes into the gut. It can actually have a beneficial effect on your, on decreasing stress and depression, anxiety. So some of those foods, for example, can be like, fermented foods like kombucha and like kefir and yogurts and sauerkraut and pickles and all of those things. So miso soups, so the next one is incorporating vitamins and supplements. So this is what Tammara was talking about in terms of, vitamin D. Vitamin D is very important. And that's why, as for preventative care, we always check vitamin D level on our patients. And interestingly enough, I'm not sure if most people know this, but if you have a vitamin deficiency, not only can it affect your brain, causing depression, but it also can cause memory loss. It can, affect your bones, your skin, kidneys, heart, etc. So it's really important to incorporate that. Things like omega-3, interestingly enough, omega-3 is good for your heart, your entire body. If you wanted to eat it through fish, that's fine. The fatty fish, more like salmon and herring and mackerel and cod and all those good things, very good for you. If not, you don't get enough into your diet, then I would recommend, and enough means at least 3 times a week. But if not, you can always get a supplement. We're looking for at least 1,000 milligrams of the EPA. So omega-3 EPA/DHA. If you're looking for at least 1 gram or 1,000 milligrams, we think that that may be sufficient to help to decrease some depression, anxiety. Vitamins, more vitamins in terms of the B vitamins, B3, B6, B8, B9, which is folic acid, B12. So if you get a B complex, that also, will help. Supplements, St. John's wort and SAMe, also to may be beneficial. There's loads of them, but those are some of the things that you might want to think about. And the next slide. Okay, so this is, this is a slide because we do know that there's some benefits with prayer, right? So even and this is not speaking to everyone, this is only for people that feel like prayer helps. Unfortunately, again, there may be, if you are reading like the Daily Word, for example, or you're reading, your Bible or your Hebrew Bible or your, Quran, and shout out also to our Muslim brothers and sisters during Ramadan. But, sometimes when we go into prayer, there may be that one word that may be so helpful to lift your spirits. So it all just depends. If this is something that helps you, just do more of it. Because again, we do know that prayer is, it can be very effective for your mood. Next. This is one that I really, because we only had 4 minutes, I really wanted to talk a little bit about transcendental meditation, because it's something easy that you can do. And even if you spend like 20 minutes, 20 minutes a day, or even if you want to spend less than that, that's fine. But this is kind of what also Tammara, as well as Nick, was talking about. Transcendental meditation, we sort of incorporated into, schools, for our kids to reduce anxiety, and to reset, to reset so you can, continue on your learning process. But also the reason why it's important is because we have studies that literally back it up. We've been using it for our patients with hypertension for a long time, and it's been very effective. So it has benefits physiologically as well as psychologically. So it's just a matter of just spending however minutes you want. We do recommend 20 minutes, but if you want to do less than that, that's fine. We do know that the benefits of transcendental meditation is such that, it decreases cortisol and serotonin levels in your body. So those are brain chemicals that are really like your, pleasure hormones. You secrete more of them when you do this very simple thing. All it is deep breathing, right? So really, it's just a matter of, there's a couple of things I wanted to show you. With this young lady in this picture, that could be one of the ways. You can cross your legs and put your hands on your knees, etc., and just relax. Or you could do it laying down, supine in your bed. You could do it however you want. We just need to take some time out. The most important thing is really, we know that there's a lot of physiologic benefits. So it's relaxation. So it's a matter of even just sitting there, relaxing your face muscles, relaxing your eyes, your mouth, your lips, your muscles, because guess what? When we have anxiety and stress, we tend to tense up. We don't even realize it. So if you just sit there or lay there and just focus on relaxing your muscles, there's a chemical, it's a parasympathetic nervous system, which actually kicks in, in which you're relaxed. And so you just really concentrate, on just your breathing. And you just take some deep breaths in and out. And you can either think of some of the stressors that are affecting you. And then when you breathe out, it's almost like you're breathing out a dark cloud from your body. It's just think of that and then breathe it out. It's a great way. I mean, it's a great strategy of mindfulness, which is so important. But we've got the studies that back it up because we use it for physical conditions, as well as these conditions aforementioned. So, so it's really important, but it's easy to do. You don't even have to think about the stressors. You could just think about a word. We call those mantras. If you want, some people say the word, that kind of thing. That's fine. Or you could say the word I am. That is a mantra. If you're interested in mantras, you can look online for those kinds of things and just repeat it over and over again. It kind of takes you away, right? But we know that, again, there's benefits of doing it. The other one I just wanted to show you is just some simple as if you put your hand on your chest like I am and then put your other hand on your belly And just concentrate, just close your eyes and just concentrate on your, chest rising and falling. That's also very effective. The only ones that I recommend not to close their eyes, if someone has PTSD, which is post-traumatic stress disorder, I wouldn't recommend that, but you still can, because closing your eyes can be more traumatic than we want. But, for all others, it works well. It works well. Next slide. Benefits of exercise. Oh my goodness. This is really important. And interestingly enough, with exercise, you have benefits physically. Everyone knows this. It helps with cardiovascular. It helps with, bone density. It helps with memory, and it also helps with mood. So during exercise, physiologically, it helps because it helps to increase what we call endorphins. Those are your natural opiates, right, that you produce in your body. So it has a euphoric kind of effect. So, but it also helps, as you can see on the slide, with self-esteem, improve sleep, reduce stress, and increase your energy levels. Of course, that's really important. But, even if you, interestingly enough, we've done studies, you could do any form of exercise, right, that is helpful. We tend to think that even high impact exercise, we call that HIIT, high intensity training, may also help even more than low impact, interestingly enough. If you are able to do high impact, then that's great. That's like running, it's running, and going all out for just like maybe 5 minutes, doing high intense workout for 5 minutes. That will give you the benefits, but you don't have to do that. If you can't, then of course, any form of exercise is helpful. Next. Yoga, that's like one of my favorite. I actually do yoga, and I've been doing yoga for about 20 years. What I would say for yoga is it has a lot of, again, physical benefits. It helps with sleep and all of that great stuff. But the reason why yoga is very important is because, again, we try to focus sort of inward because, outside there's a whole lot of noise, like a whole lot of, noise that's so distracting. We tend to place emotions to everything. So this gives you a way of trying to just relieve that and understand that, we're just getting back to our center and we're increasing our peace. And so once you get rid of that and knowing realistically that there's ebbs and flows of life, there's losses, there are gains, but it's just taking all of that out and then just concentrate inward on yourself. And this is another way. This is, again, when we talk about mindfulness, this is another great, and it's exercise. So it's a great form of reducing stress, anxiety, depression, etc. So yoga is all of that. Tai Chi is all of that as well. Sleeping, we can't underestimate sleeping. So if we're talking about decreasing, our stress and anxiety, depression, you guys, about 50% of us really don't get enough sleep. And we're talking like 7 to 8 hours. Young kids need a little bit more. They need about 9 hours of sleep. It's really important. And I can tell you physiologically what happens is this is when restoration in our body occurs, right? So when you get into a deep state of sleep, that's when all these hormones are being secreted to restore your body. That's when we increase our immunity. That's when our nerve connections are formed. So it also helps with our memory solidification for the next day. It helps to reduce blood pressure. It helps to reduce hormones that are responsible for diabetes and obesity. And then when you get into the REM stage, again, there's other physiologic benefits. That's when you start getting the benefits of reduction of stress and anxiety is during that stage. If you have any interruption in that sleep, you have to go, unfortunately, you're going back to square one. So it's actually harmful for the interruptions of sleep. It's nice to have, again, straight 7 to 8 hours. Okay, so next. Hobbies are good. No matter what you do, again, that's beneficial for depression, anxiety, stress. No matter what, even if it's learning a new language, if it's gardening, all of this stuff, whatever you like to do, because again, it sort of takes your mind away. Because during this time of COVID, because we were in isolation, we kind of were focusing really on ourselves in terms of exaggerated introspection. So certain things that we didn't like about ourselves, we were able to really concentrate on that. But hobbies are a way of just sort of displacing things into a positive way. And then you have when you have accomplished something, if you have a goal, you accomplish it through your hobbies, you feel a sense of euphoria and satisfaction, which also helps you. Next, we're almost done. Volunteering also is another way, in the same way that hobbies help, in the same way that gratitude helps. And sometimes people have to realize that in volunteering, we realize that we're not really alone, right? In how we're feeling. Other people may have it a lot worse. Some people, you just never know until you start, volunteering your time, talent, and treasure, without expecting anything in return. That really does have a beneficial effect, both physically and mentally. Next. There are some apps that you can download. Everyone knows, I think, about the Calm app, which is really nice because, if people feel calm when they're listening to certain sounds like rain or, the ocean or something like that, it's very helpful. The other one for kids is called Positive Penguin. And so that one too it's I'm sure everyone has access to the same apps, but it's something to think about, parents, for your kids, because it's actually a really good, really great app to help. Okay, next.
That is all of them.
I think that's it. So
Yep.
yeah, so this was a really great show. I'm so thankful to you, Tammara, for coming on and sharing this time. It was, it was so helpful, and I'm grateful to you for that. And I just wanted to make sure that we're able to know how to contact you, and how to contact myself in case anyone is interested in telehealth, conferencing. That would be great. We'll get that information up to you, as well as we really want to to talk about and maybe Nick, if you could post this later, but if there's anyone who needs a crisis hotline, we have a 1-800-273-TALK number. And then we also have where you can text home to 741-741. And I can give that to you, Nick, as well, to post. And then there's also online support groups that I can also to post as well. So.
Okay, sure. So we can actually take a couple of questions if there are any questions before we wrap up. If there are any questions, unfortunately, the call-in link wasn't working correctly. It wouldn't let me post the link in the chat. I had a few technical glitches this evening, but yeah, if you have any final questions, you can put your questions in the chat. And while we're waiting on those questions, you all can give your contact information, which I will display on the screen as you're giving it.
Okay. Tammara, did you want to, you're saying to verbally say that, Nick?
Yes. Mm-hmm.
Okay. Tammara, if you would like to give your information to the audience in case they're interested in contacting you.
Yes. Do I put it in the chat or I just say it now?
You can say it. I'll put it on the screen for you.
Okay, yeah, so you can contact me by phone. My phone number is 810-529-2731. Or you can contact me by email, which I think you should put that on the chat because it's pretty long. Or you can contact me through my website. It's www.abrightertomorrowcounselingservices.com. Or you can contact me through Psychology Today and just typing in my name. Psychology Today would be the easiest because it's shorter, and you just type in my name, and all of my information will pop up.
Perfect.
I thank you, Dr. Hollowell, and Nick, for having me as well. I really enjoyed it.
This was such a, it's such a good topic, and there's so many topics of mental health. And at some point in the future, I would love to have you come back because it is so interesting. Oh, one more thing before I give my contact information, there is a question, Nick, from the Tishto.
Yes.
Yes, it can. The answer is yes.
Yeah. It definitely can. They're talking about TBI, traumatic brain injury, and unfortunately, we've seen a little bit too much of that. But with the football players, that sort of shined a light on this. And unfortunately, it can manifest itself with anxiety, and it can be really, really, really serious. So it's important to sort of protect. Prevention is the most important thing when it comes to our young people, going to sports, et cetera, just to kind of protect their brains, which is important, or to steer clear of those very dangerous, sports that will cause head injuries. But it's not just sports, it's people who might get in accidents or people, who, again, are unfortunate that they have these kind of brain injuries, but it can manifest itself with mental illness, unfortunately. So... Oh, we have another question. So,
sure.
Go ahead. Sorry.
Yeah, sure. Yep. So the question is, how important is physical fitness to mental health for children, women, and men, especially during COVID-19?
Tammara, did you want to get that one?
I think we already touched on this, especially with this slide. It's very important because it increases the endorphins in the body. So it definitely helps prevent or help treat the depression.
Absolutely. Yes. That is very important. Yes.
The last thing we want to do is just sit and eat for a year and a half because of COVID,
I mean, that's what's been happening is that, people have been depressed because of the weight gain. And the latest stats were 49% of people who were working at home gained weight. So, and that in and of itself can be very depressing. So, it's very important to, to have that kind of outlet. And then just, again, it doesn't have to be anything fancy, but just have that outlet, whether it's riding a bike, whether it's walking, whether it's dancing, no matter what it is, something that you like to do. And that's why I don't sometimes even like to call it exercise. I'm glad that Mr. Seven Spheres of Money said physical fitness, because that's either that or activity is a great way of trying to describe it, because sometimes we have a block when we hear the word exercise. We're like, oh. But no, yes, and thank you for that question, because it's so important. And it's a nice, family kind of thing. So if, the parents and the kids can do something together, that's even better, because it's spending family time together. You're able to talk, to your kids and find out kind of what's going on with them, as well as, it's a just fun activity, but it's really important. But there's a lot of, things that go on physiologically in your brain that really help. Really help with to decrease stress and anxiety, depression.
Sure. So Dr. Hollowell, why don't you go ahead and give your contact information?
Okay. Yes. So you can contact me at, and this is the Detroit area, 248-559-5640. Or my email is reception@drhollowellpractice.com.
All right. Well, thank you. Thank you for that very important information. Opening up mental wellness month, mental health month. That is the month of May. So thank you for that. And as always, the way we close out, we wish you a pom-pom lifestyle that has plenty of money, peace of mind, and we want you to come join us on the beaches of the World Club. And of course, the pom-pom lifestyle is having your holistic health intact, your mental health, your physical health, your spiritual health.
Amen.
It's all interrelated.
That's right.
Yep. So thank you for joining us. And that's it. That's it for Medical Mondays. We also just kicked off our Millionaire Money May special. So we'll close out with with a brief promo detailing how you can get involved with that and what you will get from that special. But thank you again, Dr. Hollowell and Tammara, for joining us for this episode of Money Mondays. And we will see you on the next episode.
All right. You guys have a good night.
Thank you. You too.
Bye-bye.
Bye-bye.
This is DJ the Money Coach. Thank you for celebrating our 1-year anniversary with us. Thank you for the emails, videos, and the phone calls. Most importantly, congratulations to the hundreds of people who actually acquired support. Now it's time to take it to the next level. That's right. Millionaire, Money Made. I'm actually going to teach you live how to earn that 800 credit score through the Family Finance 101 course. I'm going to teach a live 3-hour course to you. That's right. After I do that, we're actually going to bring you 3 steps to success: business, real estate, and leverage the tax laws. And once we achieve that, we're going to show you how to earn with a little bit of investment in the market up to an 80% return, cash return on your money. After we achieve that, we're going to show you how to earn with a minimum investment of $7,500, how to get you to $850 a month passive income. On top of that, we're going to do 2 live Zoom trainings with Leonard Ray, 7-figure Forex trainer, 2007, Planner Tanya, 7-figure income earners who real estate, over 200 properties they own, and retired at the young age of 40 and 42. All you have to do is register now. Hit that link below, and you'll become part of Millionaire, Money Made, exclusively with Erica Williams, Classic Time, brought to you by DJ the Money Coach and the 7 Spirits of Money Team. So don't you deserve to be a millionaire next door? Consumer debt free, cash, and credit? Absolutely. Hit the link. I'll see you live on May 19th.